Today we're doing Dr. Shret's protocol of the wrist and hand. We're going to start out with his opposition test. The muscle is a grade 4 or less, so we'll go into the adjustment. We'll start out with the scaphoid, lunate, or triquetral, lunate, and then we'll go into the distal radial and ulna, carpal, metacarpal, and then we'll do a proximal row distraction, and now we'll do the distal carpals, triquetral, or trapezoid, capitate, lateral hamate, and hamate. Now we will retest the opposition, and now it's a grade 5. We're going to continue Shret's protocol into the elbow. First we'll be checking for a posterior lateral radius. We're looking for an abrupt stop. Supination's good. There's sponginess with the pronation, so we'll go ahead and adjust that. First we'll start by a cross fiber of the wad of 3. The mobile wad of 3.
Ow.
Alright, now we'll go into the adjustment. Okay, now we'll retest it. And now there's an abrupt stop. Now we'll check the ulna by contacting the medial condyle.
Ow.
There's pain, so we'll go ahead and adjust that. First, we'll cross the fingers just like this right here. And then we'll contact the ulna, and then we'll thrust from posterior to anterior. Alright, and there we go. We're going to start out with the subclavius and mid-scap. Okay, now into the teres major, the levator scap, the anterior and posterior portions of the lateral deltoid, the medial humerus, and the subscapularis belly. Okay, now we'll do the scapulothoracic articulation. Now we'll check for inferior glide of the humerus. It's not present, so we'll just lightly thrust it about 4 times. Okay. And now we'll do the levator scapular tendon. Will you please scoot over? Will you shrug your left shoulder for me? Okay, relax. Now I'm going to go over the alternative adjustments for the elbow. We're going to start out with a muscle test for the tricep. Resist. It's a grade 5, so the spine is clear. Now we're going to bend the wrist for the ulna test.
Look at the flick of the wrist.
And it's a grade 4 or less, so we're going to adjust this. We're going to adjust the ulna first off, anterior and lateral. I'll retest. Resist. Still a grade 4 or less, so we're going to adjust the other aspect. This thrust will be anterior to medial. Retest. We now have a grade 5 muscle test. Now I'm going to do the alternative adjustment for the radius. I'm going to start out with a muscle test. Extend the wrist, please. All right, now push against me. muscles grade 4 or less. So now we're going to test the brachioradialis. Okay, pull, and it's strong. So we're going to go ahead and adjust the radius, medial and anterior. Okay, and if the brachioradialis test had been weak, we would go ahead and adjust the radius posterior lateral. Okay, let's go ahead and retest. Extend the wrist. Now it's a grade 5. Next, I'm going to show 4 alternative adjustments for an anterior humerus. They all use the same muscle test. So extend your arm. Okay, hold. Grade 4 or less, so we're going to move into the adjustments. You can relax. The first alternative is alternative 1 supine. Will you scoot towards me a little? Okay. Second, sit up for me. This is diversified seated. Okay, lay back down for me. This is alternative supine number 2. Okay, will you stand up? This is the teapot. Face that way for me. Thank you. Now on 3, you're gonna push back with your elbow, okay? 1, 2, 3. Good. All right, lay back down for me. One muscle test, one more time. Resist. And it's now a grade 5. Now I'm gonna do the alternative adjustment for the SC joint. Will you please raise your arm? We're gonna test the pectoralis major muscle. Okay, resist. Okay, it's a grade 4 or less. So go ahead and lay on your right side for me. Okay, just relax. Now the proximal clavicle can subluxate medial, medial inferior, or medial superior. And the line of correction is going to be lateral, lateral superior, or lateral inferior. Okay, let's go ahead and retest that. Okay, now it's a grade 5. Now I'm going to do the alternative adjustment for the AC joint. We're going to first start off with a coracobrachialis test. Okay, please resist. Okay, it's a grade 4 or less, so we're going to go ahead and adjust. Sit up for me. Face that way. You're fine.
No, I'm fine.
Line of correction is going to be superior, inferior on the distal clavicle. Okay, let's retest. Now it's a grade 5.
Go.
Now I'm going to adjust the bicipital tendon. First, we're going to start off with a biceps muscle test. Resist. Okay, it's a grade 4 or less, so we're going to go ahead and adjust. Sit up for me. Cross your arm, please. Just one, thank you. First, you'll start off with finding the bicipital groove. And line of correction will be straight medial. Okay, let's retest. Okay. Now it's a grade 5. I'm now doing the anterior inferior humerus adjustment. I'm going to start off with a muscle test, same as the anterior shoulders. It's for the deltoid. Okay, sir, please resist. Okay, it's a grade 4 or less, so we're going to adjust. Okay, we're gonna retest now. Okay, resist. It's now a grade 5.